Hello everyone, welcome. My name is Sherilyn Powson, and as Outreach Coordinator I want to welcome you all to our February workshop. Tonight we're going to be learning the points that have been proven to be very effective in addressing joint replacement. So at this point we'd like to go around the room and everyone share with us what brought them to this workshop tonight. Terry?
I came to this workshop because I had a total knee replacement on December 10th, 12th, one of those days. And I brought my husband here so he can help do BioTouch on me with the right points.
Great. Sally?
I'm the speaker.
You're the speaker? Well, I guess that's why you're here. Did you want to share?
Sure, my name is Kim, and my husband had joint replacement in June. He had lots and lots of complications, and I would just like to continue to support his healing.
So are you doing BioTouch with him now?
I am not doing BioTouch,
But I guess
would like to learn
you're
it.
going to, right? Perry, did you want to share?
Well, as my wife said, I'm here to learn how to BioTouch her needs.
Wonderful. All right, well at this point I'd like to introduce our speaker, Sally Spoelstra. She's one of our staff members and has experienced more than one joint replacement. Sally?
Thank you. I need to tell you that I used to be a nurse, so that some of what I have to say is because of that nursing background, and then of course I have ended up being a recipient of medical care rather than giving it out, which I would much rather do. At any rate, my first experience with it was about 9 years ago. I had a first metatarsal bone in my left foot replaced. And that is that big bone below your big toe. And that's how I came to BioTouch, because the silly thing wouldn't heal. Partially because I lived alone and had nobody to fetch and carry, get the groceries, do the laundry, those things. I'm sure I was just on it too much. But at any rate, after 3 months of non-healing and not getting back to work, I needed some help and found out about BioTouch, not what they did, but that they would help. And found my way to the office, and the rest is kind of history. In looking to prepare for tonight, I wanted to bring some up-to-date knowledge to me, and therefore to you. So my sources are both the Institute of Health and the Center for Disease Control. So the National NIH, the National Institute of Health, and CDC. So you can look up everything I'm telling you tonight if you want to on those websites. Basically, there's between 27 and 30 million people affected by osteoarthritis, which of course is what I have experienced. It is a degenerative disease of the joint. Risk factors include, first of all, obesity. And I wasn't until I had this problem and couldn't do my exercise. But it is an overwhelming, apparently, predisposition to develop it. This simply the stress on the weight-bearing joints. Again, they have found several genes that they feel might predispose to the disease. The research isn't completed, so it may or may not be true. There certainly is an indication of familial lineage, which would lend itself to the idea of some genetic intervention there causing some of it. The other things are injury to the joint or injury to any of the surrounding tissue of the joint. That includes ligaments and tendons and muscle. What they have found that is kind of new news to me at least is that this is an inflammatory process. They have found that if the person has arthritic joints in their hands, they are much more likely to have knee problems. What? Okay, I started with a thumb, probably at age 50 or a little less. And then I had a little finger develop, and I've had both knees replaced. So there you go. The inflammation seems to start with the first affected joint, becomes widespread in the body, and then is what they call a cascading effect. In other words, this joint's affected, it begins to deteriorate with loss of cartilage, with bone fragments and cartilage pieces in the joint, with the bones rubbing on one another, inflammation, pain, lack of mobility, bone spurs developing, overlaying that joint, and again compounding the lack of ability to move it. And then it would seem, according to their research, that all the inflammatory cells decide to migrate and affect another joint. So there you go. You have one joint, and then you have multiple joints. Now, what causes the inflammation to start with? They don't know. That's where a lot of the research is going on, but they kind of feel that it probably has to do with environment. And that's all they'll say, environment. Living as we do and reading what we do and hearing what we do, I'm thinking it's probably both food and our, what we're breathing, what we're doing with our life, the amount of stress, all of these things. There aren't very many people with no inflammation in their body, when they're tested. Almost everybody has it. So what's that about? And so those who are predisposed with either the risk factors that I've listed and genetic, or simply because how they manage their life, we don't know. They do know that the more active people are, the less likely they are to have problems. Again, we know that inflammation is washed from the body by good circulation, good hydration, good exercise, promote strong muscles so that those joints don't, they stay apart. They have that space between them that they're supposed to have. And we know that there is great prevention of knee problems, especially if the thigh muscles are kept strong, so that those bones, the thigh bone and the lower leg bones, don't rub together. Weak muscles, and they do come together. That space is not maintained. I was pretty active before all of this, and I was active after I recovered from the foot thing. I was nursing, I was up and down flights of stairs, all of those things. Got it anyway. So, to date, in February of 2016, I had a hip replaced. And for those of you who are contemplating that, I'll tell you that when you can't move, it's probably time. And that's pretty much a walk in the park. Hips are easy. Just move after you have the surgery. That's it. Just move. Knees, then, in September of that year, I had the right knee, and in December of that year, I had the left knee. So I've had a hip, 2 knees, and a foot joint. The big thing after surgery is you got to move. It doesn't matter whether you want to or not. With my doctor, the way to get out of the hospital is to be able to follow the instructions of the physical therapy and go up the steps and down the steps and bend and get up and down off a chair by yourself and those things. And then after whatever the joint surgery is, hip or knees, you get dismissed. And boy, I was about that. But past that, you got to move. And I was doing pretty well with the knees, but we were going to Michigan in the springtime, and I wanted to be able to get in and out of a kayak, and that wasn't happening anytime soon. you know, because it's down there on the ground and you pretty much have to squat. And I just wasn't at the squatting position yet. But we got there. By the end of June, I was there. And that surprised the nurse practitioner that worked with the doctor, because she said that wasn't part of the regime, that wasn't part of the expectation. The truth of it is, the more you use the joint, the better you're going to do. Your handout, if you are one of those people experiencing these problems and are contemplating knee surgery, your handout will tell you that it will click. Well, that's how you know it's fully rehabbed. It starts clicking when you walk, which is kind of fun. I don't mind it any. I can hear it, I can feel it, but it doesn't hurt or anything. It's just kind of a strange thing. People don't go around clicking normally. The left knee doesn't click yet, and it doesn't have quite the absence of stiffness that the right one does. So apparently I have a little bit further to go on it. I'm open to any questions you might have.
So, how did BioTouch help in healing?
Oh, the biggest thing that BioTouch did for me was help with the swelling and the pain. Now, I had to move. I don't think there is recovery without the person with the new joint just simply pushing through to move. But to sleep at night, BioTouch is a great help. And of course, they want you off of those narcotics as soon as possible, but not too soon that the healing is impeded. In other words, if you have great pain, you don't heal. It sets up bad chemistry in your blood, and that does not help the healing one bit. So there's a balance. You know, enough pain medication or other modalities to keep you reasonably comfortable, but getting rid of the heavy stuff as soon as possible. And that's a part of what BioTouch did for me. Because of all the pain that I've experienced, I have less pain tolerance probably than many people. I used to say I had a very high pain tolerance. I don't believe that's true anymore. There's just been too much chronic pain. But the BioTouch really, really helps that. And definitely I could tell the big difference with the swelling as well. Mobility, I don't know. I was getting physical therapy. Certainly you have to move. And that's probably the biggest reason that people struggle after a joint surgery. It hurts. They don't want to move. No, this isn't a time when it hurts, then don't do it. This is a time when it hurts, that's good, do it. You know, and I think that's, you know, there's nothing wrong with doing BioTouch more than once a day. You know, you get up of a morning, do some exercises, it hurts like crazy, do BioTouch. Do your rest, do a little more exercise, do BioTouch before bed. I mean, you know, there's nothing that says that you are limited by how many sessions you do. And we're only talking about, what, 2, 3, yeah, maybe 5 minutes. It's not so time consuming that your life doesn't go on because you do BioTouch. It's just an incorporating thing. Can I answer anything else? Questions?
Okay.
What particular, is there anything that your husband would ask if he was here?
Well, we haven't done BioTouch before, so we want to kind of learn more about how to apply it. So.
Okay. Yeah, if you're new to BioTouch, it's a wonderful, I mean, I've been involved now for, I got to thinking, it's been 12 plus years now. It's been a long time, and I keep being here. And then I became a practitioner because I wanted to give back. So it's something that becomes a part of your life, and you just can't live without it after a while.
So, you know, I think it'd be important to tell people, so you were getting BioTouch before the operation, and I think it's important to talk about, like, BioTouch didn't alleviate you having to get the operation. It wasn't a fix-it-all for you, was it?
No, it
Right.
wasn't. Again, you know, I had other joints involved, the inflammation was there, if now that I know that piece, I think you know, doing the metabolism, doing some other things that helps the head set faithfully. Some of these other what you don't really think about as just there at the joint, anything that would reduce inflammation, reduce stress, would certainly maybe keep the joints from just disintegrating. But yeah, when they x-rayed my knees after the hip surgery, I wanted to talk to him about just, you know, kind of cleaning them up, and I'd go my way. And his words were, "They're trashed. Going in there and cleaning them up is a waste of money and time and pain. They're just trashed." Well, you know, that wasn't really what I wanted to hear. But I'll always wonder if, you know, if some other things had happened, and I'm looking forward to them finding out exactly what this inflammation is, that we can start combating that with complementary therapies and lifestyle changes. Whatever the foods are, whatever you know, we're subjected to in the environment, whatever, so that we can live healthier with less interventions from all kinds of things.
I have fibromyalgia, which is inflammation of some sort. Could that have caused my knees to go bad?
Sure, yeah, absolutely. It's an autoimmune disease in essence, and that's where the body's immune system turns on itself and starts destroying tissue.
Okay.
So, absolutely. And we didn't talk about rheumatoid arthritis, but that's another one. Typically, you know, the first joints that are replaced with rheumatoid arthritis are the hands, the hand joints. With osteoarthritis, the joints most commonly replaced are knees, hips, and shoulders. Not commonly non-weight-bearing, non-stress joints, such as hands and feet. So that also tells you something. You know, to live that lifestyle, proper way to nutrition certainly will go a long ways. And exercise. Absolutely, keeping those joints, the muscles around the joints strong is going to help.
Okay. Good. Thanks, Sally.
Thank you.
Thank you.
Thank
Sally.
you. Thank you. Thank you.
Wow, I learned so much. I don't have any personal upfront experience with it, but I did learn a lot. You know, I couldn't help but think that when Sally was talking about all of the things that are happening, you know, our environment, our diets, the pollution, whatever, it reminded me of the stress chart that Kenna.
Well, I was thinking of that too. Why don't you pull it out
I mean,
there?
it was just exactly what you said is what this chart shows with BioTouch. It's an amazing chart, and it's in the book that Kenna wrote and mentions. We're in one of the chapters, and she developed this chart. Paul's so good at doing this, I'll kind of let you kind of take over.
Can you see that thing?
Yes.
Yeah.
Well, it's kind of blurry, so maybe
Yeah,
you
that
want
doesn't
to.
matter. So we'll show it on the. But
Yeah.
so this is in the book that Kenna wrote, and the interesting thing that she talks about here is all these stressors that you were talking about, and when they bombard us for our life, it does activation of accelerated chronic stress, which creates an immune dysregulation. That's one of the things, which turns into things she talks about: cardiovascular disease, infection, which actually we could put in here, joints. And she found that when you put BioTouch into that stress cycle, you actually raise what she called the interleukin 12 levels, and which is what fights boosts your immune system. So when you were talking about that, I'm like, well, you know, even though it doesn't alleviate maybe all of the joint problems, but imagine if we started this stress cycle earlier in our life.
Mm-hmm.
You know, if we really started getting it to the kids, you know, and to the young adults. And but again, this class is about what do you do once you've had the joint replacements.
Right.
How can you use BioTouch? By the way, my name's Paul, and this is Beth.
Yes, thank you.
And we just wanted to show you how we, I just saw a presentation last night from Gary Schwartz about synchronicity. So I wonder if this is synchronicity here.
No, we look like a
Gray top and a black top and a gray bottoms and a black bottom. So it's the Paul and Bev show.
Yes, there we have it. I did not call you.
So, so BioTouch, so you've all got a, we're just going to go right into it. So you don't know anything about it, right? Yeah.
I mean, I've received it before through Integrated Touch for Cancer
Right.
and stuff, but
Right,
I haven't ever come
not
to
really
class.
learned it, right, okay. So we're going to go through the beginning, and some people who are online here just came to see Sally, so that they'll probably be leaving. Horace was on there going, well, I didn't know you guys were live. Yes, Horace, we're live.
Sometimes it would pinch us to see if we were lying.
Yeah, right. So we're going to go over what is BioTouch, how it affects for some of us who don't know much about it. So we'll go to this first page. Bev's going to take us through some of the philosophy and how we start BioTouch, and then we're going to teach the points. And as Sally said, we're only going to teach basically 3 or 4 sets of points, 3 sets of points, and then some local work. So yeah, we're talking about only 5 minutes of work to do, and that's not a problem for a husband and wife team, is it? We're not putting anyone on the spot here.
Right. You showed up, Perry.
By the way, I remember when Perry first came here.
It doesn't matter how good of a teacher you are until the recipient is ready. Nothing is received.
Sure.
Ooh, okay.
There you go.
Kicking the ass.
Hey, I'm safe until I go home.
Right home. Better you than me. Yeah, so we're on page 6 of our little workbook here, and let's talk about what is BioTouch. It's basically probably the simplest healing modality around, a very unique healing modality that uses the first 2 fingers of the hands and lightly touches on the skin very, very softly, like a butterfly, we say, and holding for 6 to 8 seconds and touching specific points on the body that address conditions and diseases of all kinds. Anything that can be medically described, BioTouch can address. So it's very effective for addressing stress and anxiety and pain. And we've even taught, children have come to our classes. It's so easy that it's easy to learn, it's easy to use, and you're immediately effective. So I'm not sure there's too many other modalities out there that are really meant for every single person. This is something that is waiting to be really given, because it's already innate in each of us to be caring, to be loving, to want to help somebody that we care about, and in many cases somebody we don't even know. But we're able with BioTouch to provide anybody with a feeling of being cared for. I just find that so unique and so connecting for all of us. And what's happening on our planet right now and everything that's going on, this is something that we all need all the time. And for those of us who are living with partners or family members or in our workforce, you can do BioTouch all the time, anytime, and you're always going to be effective. So it's just amazing what that light touch does. What it does is it stimulates the body. It opens the body to its natural ability to heal. So when we present BioTouch, we don't use words like a healer or some of the other catchphrases, because BioTouch lets all of us just be present with each other without having to worry about, is this working, is this not working, is this the right thing to do, is this not the right thing to do. It's so innate in all of us that we are offered an opportunity to just be present, not with just somebody else, but with ourselves. So it's this perfect relationship of giving, receiving. Everybody gives and everybody receives. It's just absolutely perfect. So in a very short amount of time, you can help somebody immediately.
That was something I realized that I went to a meeting yesterday. Most of the people were people who were in the healing professions. And only one lady bought the book out of 75 people was interested in the book. And she wasn't a healer, she was just somebody interested in her own health care. And it just dawned on me again how this technique, the uniqueness of it is, it's really for the masses of humanity. It's really for the people walking down Pima Street, and to create a different dialogue for our society of, yes, we can help one another. It doesn't take you to be a healer, it doesn't take you to be a special person. It's just for everyone, and it just really hit me hard yesterday, building on what Bev just said. And we just need to get it out to everybody.
So we're always saying how simple it is. This is part of the conversation that we're all having. We need to get back to simple ways of living, caring about each other. BioTouch is going to let all of us put that into action. It's not just, we're going to walk the talk. We're not, this is a modality that you can step into immediately and change somebody's quality of health. And with consistency, amazing. Yes, Sally?
As a nurse, I was expected to do the medical things. And when I first started doing BioTouch, there were both patients and my peers that said, I can't believe you're doing something that is so far out. And I said, well, one, it isn't far out. And two, I already know medicine isn't the answer by itself. It's proven. There's limitations to it. And this is another way to fill that void that medicine can't do. Medicine meaning the whole gamut of the medical regime as the Westerners know it.
Exactly.
And so
that's a great point. And exactly what we're going to talk about, how complementary and integrative BioTouch is with everything. Anything and everything. The only thing it's going to do is enhance whatever you want to pair up with it. Whether it's allopathic, a specific regimen that you're on under a doctor's care, whether it's prescriptions, whether it's other modalities, whatever. BioTouch is only going to contribute in an enhanced way to make that healing process just so much better, so much quicker, and so much more powerful. So yeah, thanks for sharing that, because to be able to use that in a professional way and to integrate it is exactly what.
And Sally did that. When
did.
she was teaching at Pima College here, and every semester she'd have us come in and do a BioTouch presentation to all those students. And thank you for doing that for all those years. And she's a maverick in that, because they're not doing it anymore.
Right.
But slowly but surely, people in the medical system are at least exposing our medical care people about other alternatives. Not necessarily that they will do it, but at least they can know about it and send them to a place like BioTouch. If we could get more surgeons saying, well, okay, I'm going to do this job, and here's your physical therapy, and also you should go try that BioTouch with it. Take your husband down there or your wife down there. So that's our goal, is to really integrate it that way.
Absolutely. I think one of the most unique things about BioTouch is that there are no levels of expertise. Once you have the technique, which is a very basic system, you are a practitioner. And the first time that you touch anybody with those two fingers, you are immediately effective for them. I don't know of any other healing modality where you don't have to go through levels of, I spend thousands of dollars and be initiated and all this other stuff. BioTouch requires only you to want to help someone. There's no intention. You don't have to have a belief system. There's no philosophy unless it's just love. You just want to care for each other and love each other. That's what it really helps us to do. And that's it. So I can show somebody immediately how to do the next set. They can do the next set on me and be completely, immediately effective. I really don't know of any other modality that can claim that. So that's why we say it is the most unique technique, the most unique healing technique. And
That'd be the most unique technique too.
Yeah, for whatever,
For
right?
all the techniques involved.
For all the techniques, that's right. So, as I said, there is no belief system. We don't hold a philosophy. When you are standing in front of another person and you are caring for them and giving them BioTouch, that's all there is. That's all that needs to happen. And the healing process begins. And it's not just the recipient. Everybody gets something in a BioTouch session with each other. That's what a relationship is. So we always wash our hands before we begin a session with someone. And then, like I said, you touch lightly on the skin with the first 2 fingers, holding 6 to 8 seconds. And that's it, basically.
So this little workbook you have here, this is just a few pages from our entire manual. And so what we've done in this class, we always used to say it was simple to learn. And then when we wrote the book, this guy interviewed us from New York, and he got the manual, and first thing he said is, well, you say it's simple, but there's 17 sets of points in here. It's not very simple. And all of a sudden it was like, God, he's right. And so we've created these workshops to just focus on a very specific condition. And then people can come as many as they want. People who become members can download all the different workbooks that we have. I think we've got probably up to 20 now or something.
Yeah.
And in 2 hours we'll be able to show you all the points. So this is just, and then what we've done is the first page, as you've all got here, is sort of a synopsis of what we've found in the medical journals about what is joint replacement, sort of what Sally built on. And thank you, Sally, that was wonderful.
Wonderful.
Yeah,
Yeah.
I really appreciate that. So that's always in front of whatever the workbook is a little synopsis of what the problem is. And we always seem to learn more at these things. I mean, that was like, oh my gosh,
Yeah.
Really working with people who've had joint replacements to help, not get more. If it's about an immune system response, then okay, they've had the first one, let's see if we can not have to do the second one, or prepare people for the second one. We also know that pre-post-op, there's nothing better than BioTouch. So if you're thinking of a joint replacement, pre-op, immediately at the end afterwards. If you've already had it, we've actually seen that one of the things people worry about also is scar tissue and those kinds of things. BioTouch has been shown to actually, I work with people who have had scar tissue 10, 15 years and it's started to break down. So, I don't know why, it's mind-boggling, but it's possible. So BioTouch has a possibility of healing us even years after an operation.
Well, and we really don't know the whole power of the body's ability to heal. We really don't know. I mean, for me, it's just like all the possibilities, all the potential. The BioTouch opens all those possibilities up for that to happen. I mean, to limit the body, why would we do that? Yes.
That would be like limiting the universe.
I know, and we can't do that.
Well, I could try. Okay, yeah.
Well, the other thing that came to me as an epiphany is that if we want to prevent the next event and we're dealing with the immune system, the center of the immune system is a bowel. I'm going, this inflammation component of the osteoarthritis is new. That was not known before. That's recent knowledge.
So having known that, we can incorporate some other things that we didn't know to do.
Well, right.
Okay.
Absolutely.
So we're going to start doing the few things that we know to do now, and we're going to bring out our mannequin, and I'll set up the camera for her. So we'll go to the greeting. That's the first thing we do.
A little helpmate.
Yeah. She's tall.
I know. Isn't she? Charlotte.
She's wearing high heels.
Are we okay?
Yep.
Okay. So the first thing we're going to learn is the greeting. So the greeting set, we do this set, the first thing we do before we address any other parts of the body. And the greeting set is kind of like the key that begins to open the body's, it kind of communicates to the body, oh yeah, we're going to start some stuff here. So that, if you do nothing but the greeting set, you're going to ignite the body into some sense of its own potential to heal. So we want to always use the dominant hand. So if you're right-handed, you'll use your right hand. If you're left-handed, you use your left hand. This is going to be the only set that you will be using one hand. And you're going to be touching the 2 points of the greeting set with the same hand. So, greeting point 1, there is just below the breastbone a soft tissue. And you want to lightly touch right in that soft tissue, holding 6 to 8 seconds. The second, at the base of the neck, we call that the big bone. Greeting point 2 is about 1 to 1.5 inches to the left of the big bone, which is at the base of the neck. And again, very lightly touching on the skin and holding 6 to 8 seconds. And that's it. That sets up, it seems to set up a harmony between the associate, the one who's giving biotouch, and the recipient, the one who is receiving. Yes? Okay.
Now we're going to practice the points.
Yeah, we're going to practice these in the room. So if you have any questions, please don't hesitate to ask. Some of us already know how to do those things since he took the class. Yes, you.
How many years ago was that?
Enough.
Yeah.
Okay, so one of the other sets that we're going to use to address this condition of joint replacement is the metabolism set. And this is a great set because it helps the body to get rid of what it doesn't want and to take in what it wants to have, so for the healing process. So this is a really great set to use for this condition. So again, we've given the greeting, so now we're going to do this set which has 2 steps to it. In step number 1, we're going to be working just along this large muscle on the front of the neck, and we're going to be using both hands. We're calling this matching fire. So you're holding 2 points simultaneously on the body. And points 1 and 1 are just in those indentations above the collarbone. Remember, we're holding lightly 6 to 8 seconds. Points 2 and 2 are halfway up the neck in front of that large muscle. And points 3 and 3 are at the top of the neck in front of the large muscle. We want to touch really lightly because this is a sensitive area. So that's step number 1. In step number 2, we're going to have a whole point, and we're going to be touching points on the back of the body. So we're going to be working in what we call through fire. So we're going to find our whole point, which is, if you imagine a line that runs along where the nipples would be on a youth, you're going to be about 1 to 1.5 inches to the left of the breastbone. That's going to be your whole point, which means you're going to be holding those 2 fingers constantly on that area. And then we're going to be working on the back of the body. So we have a reference point called the breakover, and it's basically where the bottom of the ribs join the spine. You can see it's a very definite curving up of the spines and where it joins the ribs. So we're still holding on the front of the body, and we're going to be working in a rectangle. We want to stay below the shoulder blades, and we want to be above the hips. So point number 1 is on this large muscle on one side of the spine, and it's about 1 to 2 inches above that breakover point. So we want to hold that there, point 1, on the left spine muscle. Point 2 is directly across on the right spine muscle. Again, below the shoulder blades, about 1 to 2 inches above that breakover point. And point 3 is about 2 to 3 inches below the breakover point on the right spine muscle. Again, you want to stay above the hips. And you can repeat any point, sets of points, as many times as you feel that you want to. It might just come to you to do it 2 or 3 times. So you can always repeat that sequence of points in a set. So that's the metabolism set. I think the third set that we are going to use is the stress set, which just helps the body to, take care of any anxiety or anything like that, anything that comes up. It's just helps the body to relax. So we're going to find the whole point, and that is going to be at greeting point 1. Remember that fleshy area just below the breastbone. And again, we're going to imagine a line which runs along where the nipples would be on a youth, and we're going to imagine a diagonal line that runs from the notch at the top of the breastbone down to that point where the nipple would be on a youth. And we're going to divide that line into thirds. So you're just working in thirds. And for point number 1, let's see, Perry, put it on. We're going to be at the top of the first third. And we're just going to follow that diagonal line, that imaginary. It shows it as a dotted line in the manual. And point 2 is at the top of the second third. And then you can always repeat those 2 points. It's just 2 points. Very easy. But very, very effective, actually. And that's the stress set. So, I think what is left is Paul is going to share.
So now we go to the specifics. So your husband had what? The
Knee.
The knees, okay. So the way that we work with any kind of extremities or any kind of local work is what we call addressing enhancements in local work. Enhancements are basically 3 different ways we can touch. So if all you even did was the greeting and then just went to a local problem, there's 3 ways that we touch on a local problem. And we'll just show it on this elbow here. So one of the ways we touch is now we have both hands, we can take 2 fingers and just touch on the pain. That's one way that we touch. Another way we can touch is through the pain. So side to side, front to back, and just holding 6 to 8 seconds. Even any direction you want. So we touch on the pain, through the pain, and then we do what we call sweeping, which is when we slowly and deliberately move our fingers across an affected area. It could be right on top of it. I could keep one hand stationary while I move the other hand. I could come around. So your fingers can do anything. The nice thing to remember is you can never hurt anybody. And so if you think, well, I wonder if I could do this, do it. If your mind's thinking it, then do it. The only thing we don't do is we don't touch our hands together, okay? Just move them apart and pick up where you left off. So even if all you did was the greeting, you know, like Sally said, if you just did the greeting and then just did some local work after an exercise program, and maybe you did the metabolism only once a day, but you did local work 3 or 4 times a day, you know, that metabolism is going to build over time. The local work will help the inflammation for that localized area. So that's how we locally work any particular area immediately. When we're starting to deal with the whole body itself, we know that the nerves of the body come to different areas. The nerves off of the spine go to areas of the body. And we do know that the nerves in this area go down into the legs. So in BioTouch, we're always addressing the nerves of the spinal column to the area of the body we want to work on. And so what we do then is we always take and we put 2 fingers on the problem. So if we're doing a knee, we put 2 fingers on the pain of the knee. And then we take our other 2 fingers and we put them in a corresponding area of the back where the nerves are. So anywhere in that low back where we know nerves come off the back and go down the legs. So all the nerves from this area go down into the legs. So I can just put 2 fingers on the knee and 2 fingers somewhere on the spine. And I can hold that for 6 to 8 seconds. And I might even just sweep down the spine a little bit.
Yeah.
Oh, there we go. There.
Here we go.
Okay. Then I can take and bring those 2 fingers down to the area that I want to work on. And then locally work on that knee, the way we just talked about it. I could do through fires. I could do some sweeps around the knee. And if I do it slow enough, I'll feel maybe my fingers will drag, or I might feel heat. I might want to just stop for a little while. I might want to hold in the back and just go right over the kneecap. So any kind of thing I want to do. Now the other thing that we want to do, especially with knee replacements, is we also want to work on this thigh. One of the main things, as Sally was saying, is you got to get this thigh strong. So we might come down the thigh into the knee to get that muscle that's to get the knee from rubbing all the time. Mm-hmm. And so you might want to work on that thigh muscle too, into the knee.
The muscles are really weak afterwards.
Right.
That's why, you know, there's so much rehab to do.
Yeah.
The other thing to be mentioned that I didn't think about when I was talking is there is a ligament that goes from the hip to below the knee on the lateral side, right there where you have your hand. And that tends to be inflamed after the surgery and somewhat painful. And that's normal. You just have to work. You know, again, BioTouch will help that greatly. Greatly.
So
not everybody has the pain, but many do.
Right, and one of the best things in the situation is you touch where they say it hurts. They'll tell you where the inflammation is because it hurts, you know, or you'll see it, you know, or you'll sometimes if you just even rub your hand over it, you'll start to feel, oh, it's really hot there, and so you might just want to work. And so you can either do 2 fingers all the way down to the knee, down those muscles, down that ligament, or you can do 1, and then just working all around that knee. And we would do the same thing with a foot or an ankle. So anything that we want to do to help all the way from these hips, if we're doing hips, right, it would be the same thing. You would just start working front to back. You might work the muscle in that low back area. But even after a knee replacement, you'd want to be working all around those areas to help the hips move, and you know, because you're just all locked up. So just, you know, front and back, coming into here, then maybe even from the back coming down that ligament. Again, from wherever they're telling you it's hurting. That's where most of the work is done with the local work.
Well, the other thing about the hip is they at least move muscles aside, if not cut some. So it's real important to spend time where the scar is and around the scar, because that's a massive healing has to happen there. And while it's easy recovery, it's still, you know, you've been hurt and brutalized. You gotta have some, gotta have some care.
So that's mostly what we'll practice in the room. If it was shoulder replacement or you'd do the same thing here, but you'd come from the neck area and do the shoulder. But I think in the rooms we're going to practice more on the knees and hip area and those thighs, so you can get a good sense of how to do that. Any questions about that? We're going to practice these in the rooms. For all of you who are out there on the video, if you want to download our workbooks, just become a member and you get the whole manual with the DVD, and you can download all these workbooks for free as a member. So we're going to practice the points, and we're going to say bye-bye to the live streaming people.
Bye.
So,
We get to work on that. Okay.